Okay, so now we're going to discuss the anti-inflammatory agents and the NSAID or the non-steroidal anti-inflammatory drug. So first is, what is anti-inflammatory? So this is a drug or substance that reduces inflammation, redness, swelling, and pain in the body. So certain bodily chemicals that promote inflammation are blocked by anti-inflammatory medications. They are employed to treat a wide range of ailments. Cancer prevention and therapy with some anti-inflammatory medications is currently being researched. So anti-inflammatory, the inflammatory reactions such as vasodilatation, increased vascular permeability, cell proliferation, pain, and etc. are mediated by the release of multitude of chemical mediators having varied mechanisms of action. The inflammatory stimuli in the inflammatory cells induce synthesis of prostaglandins through COX-2. The NSAIDs exert anti-inflammatory effect by inhibition of prostaglandin synthesis by reversible inhibition of this enzyme. So the primary method of which NSAIDs work is by inhibiting the cyclooxygenase enzyme or COX. Arachidonic acid must be converted into cyclooxygenase in order to produce thrombosanes, prostaglandins, and prostacyclins. The absence of this L the absence of these eicosanoids is thought to be responsible for NSAID's therapeutic benefits. Now, we have the non-steroidal anti-inflammatory drugs or NSAIDs. NSAIDs are heterogeneous group of drugs having analgesic, anti-inflammatory, and antipyretic effect. Unlike morphine, they do not depress CNS or central nervous system, do not produce physical dependence, have no abuse liability, and are weaker analgesics. They are also called non-narcotic, non-opioid, or aspirin-like analgesics. They act primarily on peripheral pain mechanism, but also in the CNS to raise pain threshold. So non-steroidal anti-inflammatory drug, a medication that is commonly prescribed or purchased over the counter to treat the inflammation associated with conditions such as arthritis, tendonitis, and bursitis. Examples of NSAIDs include aspirin, indomethacin, or brand name Indocin, ibuprofen, brand name Motrin, naproxen, brand name Naproxen, Pyrosicam, brand name Feldin, and Nabometone, the brand name is Relefen. People who take certain NSAIDs may have a higher risk of having a heart attack or a stroke than people who do not take these medications. The risk may be higher for people who take NSAIDs for a long time. Other major side effects of NSAIDs are gastrointestinal problems. Some 10 to 50% of patients are unable to tolerate NSAID treatment because of these side effects, which include abdominal pain, diarrhea, bloating, heartburn, and upset stomach. So these are the main types of NSAID. We have ibuprofen, naproxen, diclofenac, selecosib, mefenamic acid, etero, et, etero, etoricosib, indomethacin, aspirin for pain relief, and they are frequently used to treat conditions like arthritis that can lead to chronic pain, headaches, painful periods, pains and strains, colds and flu, and even coronavirus or COVID-19. NSAIDs are frequently used, but they are not appropriate for everyone and can occasionally have negative effects.
Good day, everyone. So for today's video, I am going to discuss corticosteroids. So corticosteroids, they are a group of steroid hormones which are made by the adrenal glands of the kidneys. Corticosteroids are actually classified as glucocorticoids and mineralocorticoids. Glucocorticoids, they are used so commonly in pharmacology, and they have a tremendous impact on the immune system's inflammatory response. Mineralocorticoids, which include aldosterone, this steroid regulates the balance of water and salt in the body. Corticosteroids medications are synthetic drugs that closely resemble cortisol, that is our stress hormones that is made by adrenal glands. It is very powerful, and they are used to prevent inflammation by suppressing immune system. As you can see, they are used by many routes, and they are used for everything from brain tumors to skin conditions. They are used by mouth, intramuscular, and intravenous. And also they are used for arthritis or colitis. They may be used to prevent organ rejection in individuals that have organ transplants. They may be used topically for skin conditions or ophthalmic for eye or ear inflammation. Some nasal sprays may contain cortisone to decrease the swelling in the nasal passage and make it easier to breathe. Corticosteroids may be given by inhalation for inflammation that is happening in the airway. They may also be given rectally for hemorrhoids, or they may be injected directly into the joint to treat or help stop an inflammatory process in a joint. So these are the examples: prednisone, dexamethasone, cortisone, and the triamcinolone. Corticosteroids can cause many different side effects, so the mnemonic corticosteroids should help you remember them better. The first C stands for crushing syndrome, which will include a lot of following side effects as well as things like the moon phases and the buffalo hump. O is for osteoporosis, so be careful giving corticosteroids to patients already at risk, such as elderly women. You may need to give calcium vitamin D or bisphosphonates alongside the steroids. R is for retardation of growth, and this is of course in pediatric patients. T is for the thinning of the skin as well as easy bruising, and we can also remember delayed healing of wounds. I stand for immunosuppression, giving a large risk of infections, and C stands for cataracts and glaucoma, specifically posterior subcapsular cataract. O is for edema. This happens because steroids cause salt and therefore fluid to be retained within the body. Next, we have S for suppression of hypothalamic pituitary axis, and T that stands for teratogenic. And we have E for emotional disturbances including depression, irritability, and anxiety. R is for rise in blood pressure, meaning hypertension. It can also help you remember right or left-sided heart failure that can be worsened by corticosteroids due to the fluid retention. O is for obesity, specifically central obesity. I is for an increase in body hair growth known as hirsutism. D is for diabetes mellitus because corticosteroids can lead to hyperglycemia. Then we have S, which stand for striae, which red or purple marks that can be seen on the skin. Additionally, S also reminds us of stomach ulcers, which tends to happen mostly in patients that are taking NSAIDs, as well due to a potentiated risk of stomach ulcers. For patient teaching for glucocorticoids, you should always include the direction to take as directed. You never want to stop these medications immediately if you're taking them for any length of time. Watch for the side effects and the adverse effects. You want to monitor the patient's white blood count and look for signs of infection. The patient may have poor wound healing and be more susceptible to getting sick. You also should monitor vital signs, blood pressure, and weight gain. So now we will proceed to the disease-modifying anti-rheumatic drugs, or the DMARDs. Disease-modifying antirheumatic drugs are one of the many medication options available to treat diseases of the immune system. DMARD's drugs are medications that work to manage and reduce inflammation and to prevent permanent joint damage. Inside the tissues of your body, there are many cells that work as a part of the immune system. When you have inflammatory disease, there are some cells that work normally and some overactive cells that are causing unwanted inflammation. We know that DMARDs are able to stop or reduce the number of overactive cells in the immune system that causes inflammation. There are multiple pathways that DMARDs can take to control inflammation, including calming or stopping cells from activating and releasing chemicals, and they can work by stopping overactive cells from multiplying. Other medicine like NSAIDs, they are sometimes added initially to provide faster relief of the pain, because when patient comes to you and you give some description, the patient always wants to have some response. If a patient is taking medicine for a week and is not getting any response, the patient might be reluctant to take further medications. Before starting the treatment, briefly explain the patient the possible adverse effect, the dosing regimen, because this is very much important. You have to tell the patient that you are going to have a long-term therapy, initially of 4 to 6 weeks. Then after the therapy, you will find out the expected results and then explain to the patient. DMARDs are taken a couple different ways, which includes by mouth, as a liquid or pill, or as injection under the skin. They can be taken 1 to 2 times a day or only once a week. Most people have no problems with their DMARDs, but some people may experience some side effects. The side effects depends on which DMARDs is used and how much is being taken. Some effects that you might experience include nausea, feeling tired, stomach pain, skin rash, and low blood count. If you have any of these symptoms or specific concerns, talk to your doctor. When using DMARDs to control inflammation, there are some important instructions and tips you need to follow to keep you safe. Patients who are on a medication called methotrexate, cannot have live vaccines, cannot take some types of antibiotics, should not get pregnant, and should avoid alcohol. They also have to take a vitamin called folic acid to lessen side effects. Patients should also have regular blood tests to check if their liver function and blood count are normal. There are a lot of things to consider when deciding on treatment options, so it is important to know as much as possible to get more information, or if you have any questions, talk to your healthcare team and doctor.
Hello everyone, my name is Maria Glenda Podetera, and today I'll be discussing about anti-gout. So what is gout? So gout is an excruciatingly painful form of arthritis. When your body has an excess of uric acid, sharp crystals can form in the big toe or other joints, causing swelling and pain known as gout attacks. Gout can be treated with medication as well as dietary and lifestyle changes. Gout is a group of metabolic disorders characterized by an increase in the concentration of urate in the blood, which is called hyperuricemia. Urate levels normal 1 to 4 mg/dl. A low pH uric acid, a byproduct of purine metabolism, has a low water solubility, which is acidic. Tophi occurs when the urate level in the blood rises and precipitates and deposits in the joints, kidneys, and cutaneous tissue. So what are the causes? When some foods and beverages that contains purines are broken down by the body, uric acid is produced. When you urinate, this typically waste product passes through the kidneys and leaves the body. The body occasionally makes too much uric acid, or the kidneys aren't able to handle it well. Uric acid crystals can accumulate in the joints when there are excessive levels of uric acid in the body, a condition known as hyperuricemia. Gout is brought on by the sharp needle-like crystals. Many individuals with increased uric acid levels don't never develop gout. Gout causes. One of them is excessive consumption of alcoholic beverages, particularly beer or purine-rich food. Other one is glycemia, a condition treated with chemotherapy and radiation causes increased nucleic acid metabolism and uric acid production. And then lastly, thiazides, furosemide, pyrazinamide, ethamobutol, levodopa, and clofeprate are drugs that reduce uric acid excretion by the kidney and cause gout. So anti-gout drugs. These are the gout treatment that involve one of the following mechanisms: by preventing the formation of uric acid, allopurinol, increasing excretion of uric acid, probenecid, sulfenpyrazone, preventing leukocytes influx into the joint, colchicine, providing SAID activity in general, glucocorticoids. Classifications. For gout that is acute, gout is a painful condition that often only affects one joint. Drugs like colchicine, glucocorticoids, and NSAID are utilized. For those who have hyperuricemia or chronic gout, recurrent attack of pain and inflammation are hallmark of chronic gout. It is possible for multiple joints to be impacted. Sulfenpyrazone, allopurinol, and probenecid. NSAID drugs. Several medications such as indomethacin, naproxen, piroxicam, diclofenac, or etoricoxib are used at a high and recurrent dose to end the condition. It is favored over colchicine, despite producing delayed reaction and having greater tolerability. Naproxen and piroxicam both prevent leukocyte hemotactic migration into inflamed joints. However, long-term therapy is not advised due to the possibility of toxicity. Colchicine, Colchicum autumnale, alkaloid in 1763. The autumn crocus was discovered as an anti-gout remedy, and in 1820 it was purified. Used only to treat gout inflammation, neither anti-inflammatory nor analgesic in nature. Eber's papyrus, or Papyrus Ebers, contained the earliest known dates for information about colchicine, and it was written around 1500 BC. Additional effects of colchicine. So antimitotic, antimitotic, binding of to microtubules of mitotic spindle, metaphase arrest tried for cancer chemotherapy but causes toxicity. Gut action, gut motility through neural mechanism, and the pharmacokinetics, which is absorption, rapid orally, distribution, uniform, metabolism, liver, elimination, bowel undergrowth, enterohepatic circulation, urine, and feces. So colchicine toxicity is high dose dependent. Nausea, vomiting, watery or bloody diarrhea, and abdominal cramps occur at therapeutic doses. Drug accumulation in the intestine and mitosis inhibition. Colchicine overdose result in kidney damage, CNS depression, and intestinal bleeding, as well as death due to muscular paralysis and respiratory failure. Colchicine use. First is acute gout treatment. 1 mg orally is the best drug to control an acute gout attack. Then 0.25 mg every 1 to 3 hours until the attack is under control. Number 2, gout prophylaxis, colchicine, 0.1 to 1 mg per day prevents gout attack, but NSAIDs are now preferred. Other application in plant breeding, polyploids is used to create new or improve variety strains, cultivars, and by inducing polyploids, the states of cell organism having more than 2 pairs. Corticosteroid, which is an intra-articular injection of soluble steroids, suppresses acute gout symptoms. Second is corticosteroids reduce gout pain, swelling, redness, and inflammation. Third is, however, corticosteroids are only used in patients with renal failure or peptic ulcer because NSAIDs are contraindicated. And then fourth, the risk of relapse of an attack is observed during drug withdrawal. And lastly, prednisolone 40 to 60 mg, for example, is administered once daily. Excuse me. Toxicity of probenecid. Dyspepsia or indigestion, rashes, and other forms of hypersensitivity, convulsions, and respiratory failure are caused by toxic doses. gouty arthritis, and hyperuricemia, allopurinol second line or adjunctive drug 0.25 to 0.5 gram BD gradually reduce blood urates level in patients with arthritis, tophi, and other lesions, but is ineffective in patients with renal insufficiency. And lastly, to avoid urate crystallization in the urinary tract, take probenecid with plenty of fluids. Extend drug action. Probenecid is also used to increase and maintain blood levels of penicillin or ampicillin, as in gonorrhea and subacute bacterial endocarditis. As you can see all the mechanism of action of probenecid, which is a lipid-soluble organic acid developed in 1951. You can see the probenecid block active transport of organic acid by blocking OATP, inhibit, it causes excretion, and then reabsorbed by active translation, and you can see the uric acid. And on the bottom right, you can see the capsule, which is the probenecid and colchicine tablet. The pharmacokinetics, which is absorption, rapid orally distribution, 90% about the plasma protein, metabolism is liver, elimination is urine. Drug interaction with other drugs, probenecid shows interaction with such as like antibiotics, NSAID antibiotics, and antimicrobial, which are category drugs. An example from class is penicillin, cephalosporin, sulfonamides, indomethacin, salicylate, rifamycin, nitrofurantoin. Interaction inhibits in urinary excretion, biliary excretion, inhibits tubular secretion of the drug. So now you can see, now it's sulfenpyrazone, which is a pyrazone derivates from uricosuric activity that is related to phenylbutazone. It does not have anti-inflammatory or analgesic activity, but is used specifically to treat gouty inflammation. Mechanism of sulfenpyrazone. It prevents uric acid tubular reabsorption, and it also prevents platelet aggregation. Now you can see the drug interaction with other drugs. Sulfenpyrazone shows interaction. Same category drug, oral anticoagulant, which is example from class warfarin and tolbutamide. Interaction increased the effect. Anti-asthmatic, theophylline, worsening asthma. And then category of drug is calcium channel blocker, verapamil, high blood pressure or irregular heartbeat. Adverse effect of sulfenpyrazone, gastric irritation, so contradicted in a patient with peptic ulcer, rashes, other and hypersensitivity reaction, at overdose, convulsion, coma, anemia, jaundice, and ulceration. Use of sulfenpyrazone is a treatment of chronic gout, 100 to 200 mg BD. You can see here the medicine that is used. The adverse effect of allopurinol, hypersensitivity, rashes, fever, malaise, and muscle pain, Steven-Johnson syndrome, a series over skin and mucous membrane, painful red and purplish rash, gastric irritation, headaches, nausea, and dizziness, and frequent liver damage. Allopurinol use. So this preferred indication of chronic gout to enhance the effect of 6 mercaptopurine or azathioprine during cancer treatment and immunosuppressive therapy, inhibits leishmania and altering purine metabolism in Kala-Azar treatment. And that's it. Thank you for listening.